All right, welcome back, folks. This is part 2 of the IEP or Individualized Education Program series. I talk about goals. So goals are set by how the child is functioning, which is derived from present levels. Present levels are derived from a lot of different data points, including evaluation. Especially if it's an initial evaluation, you'll get a lot of present levels from that initial evaluation that should have academic, social, emotional, different types of levels. So the goals are based on the needs of the child to meet the standards for general education. So that's what the goals are set at. So the goals do need to align with standards. So this gets really difficult, especially if you're thinking about a student who is, say, autism spectrum disorder level, level 3 or level 2, where they need substantial support and may have some cognitive deficits where, typically the rote memorization is there, but the application or comprehension or generalization of skills is not there, which means that, they can remember sight words, but maybe putting them in a sentence or understanding what the sentence is even saying, a little bit higher level skill. So how do we meet standards for that? You might see things on goals such as using the language or using key terms from the curriculum. So they're trying to tie what they're learning in class to that goal. So, and your district should be following the SMART acronym, okay, for goals. So it's specific, measurable, attainable, realistic, and time sensitive. So realistic or relevant, depending on who's teaching this. Anyway, so that's the overall format for the goals. A requirement for an IEP is to ensure that they have objective dates or dates where they should hit specific targets. So in your goal, you should see objective dates. So by such and such date, and you really should see a way to measure the goal. That's a legal requirement as well, making sure there's a way that they're measuring that goal. And I will say, if the goal is very wordy and it's using a lot of different types of data, I would probably venture to guess that goal is going to be a lot less monitored. So knowing how they measure the goal is going to be pretty important, and having them explain how they're going to measure that goal. So the goals have objective dates, and they have terminal dates, or dates like when they have to end or when they should meet the overall goal, which is a year usually. So the goals are set for usually a year. And then again, kind of like the annual IEPs, you review them, such and such. So, and goals can be a lot of different types of areas. So a lot of different areas. It could be social, emotional, it could be academics, it could be behavioral, it could be a physical goal or adaptive goal. So it's, again, based on the disability category and needs of the child. All right, so from here, we're going to move on to talk about services, and then the assessment, participation, accommodations, modifications, things like that.